If you or your loved one recently had a chemical pregnancy, I'm so sorry. Like you saw a positive pregnancy test, but a few weeks after that, you saw it was negative. What could this mean? What could have happened? Was there anything you would have done to prevent this? Is this going to affect your fertility in future pregnancy? Stay tuned and I'll answer these questions. Welcome to my channel. If you're seeing my face for the first time, I'm Dr. Cherit Vitazan, and on this channel we talk about all things pregnancy and family planning. If this is something you like to see more content on, please ensure to click on the subscription button, notification bell, like this video, share this video. Let's get into the video of today. Let's get back to chemical pregnancy. Chemical pregnancy is a pregnancy that is lost within 5 weeks of conception. So what this means is simply 3 weeks after ovulation, you lose that pregnancy. That is what chemical pregnancy is. Statistics has shown that 25% of all pregnancies will end up as chemical pregnancy. So it is not something that is your fault in any way. It happens to women all over the world. Chemical pregnancy is very different from first trimester miscarriage, which is more than 5 weeks of pregnancy. You can actually see that there's a baby on the ultrasound scan. So you see the gestational sac will be seen when you go for scan. But with chemical pregnancy, there's no clinical evidence of this pregnancy. The only evidence to show that you were pregnant is that you got a positive pregnancy test, but which later turned out to be negative. Before moving to the symptoms of chemical pregnancy, I just want to state that many women who experience chemical pregnancies don't even know that they have experienced this chemical pregnancy, particularly for women who are not actively trying for pregnancy. They just count it as normal. But for women who are trying to get pregnant, they are the ones that would see that their pregnancy test was positive initially, but then turned out to be negative. So, moving on to the symptoms. Here are some symptoms of this chemical pregnancy. The first symptom is that you will notice that your period delayed for at least 7 days than more than usual. When your period eventually comes, because your period will come, that's the thing with chemical pregnancy, your period will definitely still come. So when your period comes, it is heavier than usual. You may feel some kind of mild cramps. If you previously did not have menstrual cramps, in this particular period, you would feel some cramps. Another thing that you would see with this period is that there will be pieces of blood clots. This is to show you that fetal tissues actually passed in this period. Another symptom of chemical pregnancy is that you would see a positive pregnancy test, but after that, it's followed by a negative pregnancy test, even if you do it multiple times. Another symptom is that the symptoms of early pregnancies will not really be there in chemical pregnancy. And then you may be wondering what actually causes or what can cause chemical pregnancy. Chemical pregnancy is just something that modern nature does for us. So oftentimes the pregnancies that pass as chemical pregnancies are fetuses that are not really compatible with life because of some chromosomal or genetic abnormalities. So instead of being born, Mother Nature just has a way of preventing those kind of pregnancies from progressing. Another cause of chemical pregnancy is low maternal weight. Women who are underweight have been shown to be at higher risk of having this chemical pregnancy. Another cause of chemical pregnancy would be uterine fibroids. So fibroids in the womb can affect or take up space where this baby would have implanted in the womb. So because of this, the baby would pass and fail to progress. So is there anything that could be done to actually prevent chemical pregnancy from happening? Chemical pregnancies cannot really be prevented because you don't even know what is going on within you. Because as I've said, about 20% of all pregnancies will end as a chemical pregnancy. But this would not affect your future fertility. In fact, it has been shown that 2 weeks, immediately 2 weeks after a chemical pregnancy, a woman can still ovulate and her chances of getting pregnant again is very likely. So there's no fear of infertility in the future. In fact, after every miscarriage, it has been shown that women are more fertile. So if you want to try again for another pregnancy, another baby, you can go on ahead, unless, of course, there is a contradicting statement from your doctor asking you to calm down before trying again for pregnancy. So how can chemical pregnancy be treated? Oftentimes, you don't even need to go to the hospital for chemical pregnancy because every fetal tissue would pass in that period. But if you feel like you need to visit your doctor, please actually visit your doctor. But the beauty of the one thing about chemical pregnancy even is that you won't even know. Most women don't even realize that they've had a chemical pregnancy. The only thing they can point to is the fact that, oh, their period for a particular month was heavier than normal, or they saw thick blood in their period. Those are just the symptoms that they would tell you without even knowing that they were actually pregnant but they lost the baby. So it is not something that would warrant a medical hospitalization as with first trimester pregnancies where more interventions would need to be done. With this, we've come to the end of this video. Tell me what you learned in the comment section and ensure to give this video a thumbs up. Please subscribe to my channel to get more videos relating to pregnancy and family planning, and I'll see you in my next video.